Back from Caring Medical Center, I'm so happy to welcome back our next guest to the show, Dr. Timothy Special, a prolotherapist at Caring Medical Center. Good morning.
Morning,
Welcome
Carly.
back.
Thanks for having me. Always enjoy it.
Yeah, I'm glad to have you here this morning. We were talking about in the commercial break, we're talking about back pain this morning and mid-back pain, which I think is extremely common, is it not?
What's more common than people realize, Carly, like we were just talking about, I'm 6'2", was 6'2", shrinking a little bit, but just the mechanics of people, if they're staying, if you bend over a little bit, okay?
Well, I was giving you the example of washing dishes last night. I mean, it was like just 2-3 minutes of it tops, and my back was, I've never had more back pain than when I did washing dishes.
You're a young girl. Okay, the mechanics are right. The builders didn't build your, honestly, sink too high. You're not really tall, but still, and it's enough. And so chronically, over the years, you're going to get these little microscopic tears in your back, okay? And eventually the muscles are trying to hold that back. It's not a muscle problem. The ligaments will start stretching, okay? And people are going to have mid-back pain. And I've had myself, like even rib pains from the front to the side. And you're saying, wow, they can be, think about this. We're breathing continually, 15 times a minute, 12 to 15 times. So you never give your, it never rests your ribs. So these rib pains from the back to all around the side can be brutally painful.
Do they just automatically get worse as we age too?
Yes,
I mean, unfortunately.
I had a girl in my office. This is a really interesting case. She was 15 years old. She had from here down to here, and they were gonna, she went to the surgeon. She had like a $20,000, $25,000 workup. They were gonna remove her spleen. And her mother like the research, I don't feel good about this. I'm going to go see Dr. Special. I saw her. She had something called costro, which is rib, chondrocartilagitis. She had an inflammation of a rib cartilage junction that referred to her back. And I did some prolotherapy, which is regenerative medicine.
Yes, explain what prolotherapy is.
Prolotherapy was developed in the 1940s by Dr. Hackett. And if we inject irritants like dextrose or platelets, which is our body, you're familiar with platelets, people taking aspirin for, or our own body stem cells, either fat or bone marrow, we can rebuild our body naturally in about 85 to 90% of cases. And it rebuilds the weak ligaments and tendons and joints. In usually 4 to 6 visits, most people are much, much improved.
So the spine, is that a common place where you guys are using prolotherapy?
Well, we do a lot more than you think. Like, obviously, the lower back, I'd say more so, but many people do get mid-back from neck, and they may come in. That's why you want to have a physician like Dr. Hauser, who's a physical medicine doctor, myself, I'm an orthopedic physician. We're skilled in the musculoskeletal system examining someone. So they may come in, Carly, with mid-back pain, but as we examine them, say, you know something, it's coming from your neck. So, so you have to examine someone, but there are a lot of cases that it is in the mid-back, okay? And then, and the mid-back is extremely complicated because there's vertebrae coming down, your ribs attached there, you're breathing all the time. You don't get a chance to rest. Okay? So, but it works really, really well. And a matter of fact, we had a girl recently here. She had pain for years. She's a dental assistant, didn't know what to do. Multiple physicians came to me. I only did a few sessions on her. She's doing really, really well. She got the quality of her life back, and that's the most important thing.
Well, and that's what I love about you and your team. You're very passionate about this. I think at first glance, I mean, you know, people aren't hearing about this in their doctor's office every day, but you guys are trying to change that. And I think the more you get more success stories and the word out, one of the ways you're getting the word out is you're having a seminar coming up in January where you're inviting people to come and find out more. Ask all the questions you want, right?
Well, Dr. Hauser and myself are getting a seminar January 14th at Candlewood Suites, and you can go to our website, which is caringmedical.com, and you can learn more about it. You can call the office. Great people working as part of our staff, and we're going to teach people. We have a teacher's heart. We want to help people to understand. And you know something? Maybe they're not candidates for prolotherapy, but maybe they are. And maybe we can guide them even with some nutrition, or maybe some exercise, some posture, or maybe we can even guide them to some other therapists or professionals that maybe they'd be better suited for that.
So if somebody's watching this morning and they don't want to wait till then, they want to find out if they're a candidate, if this something would be able to help them, what would you suggest they do?
I'd say go to our website, caringmedical.com, call our staff. They're very informative, they're patients, they're very kind and caring and knowledgeable, and then they can guide you and maybe make an appointment with Dr. Hauser or myself. We can evaluate you and we'll let you know if you're a good candidate.
All right. Well, Dr. Special, thank you so much for being here this morning. We love having you on, and we look forward to having you back and hopefully helping more people here in Southwest Florida.